watching Let's Chat.
I'm here this morning with my friend Philip Edwards, who owns Senior Benefit Solutions Incorporated, to tell us all about Medicare, the status of it, what's going on right now. So I enjoyed learning about your business and that you work with 3 Medicare plans. Is that right?
We work with actually several, but there are 3 here in our market here in Tennessee that are 5-star rated by Medicare. And of course, there's 2 in North Georgia and 2 in the Alabama market as well.
So a 5-star rating holds with it a unique opportunity that our viewers might be surprised to learn about in terms of enrollment. Can you tell me about that?
Yes, ma'am. So, normally people think of the annual election period that passed back in the fall, that's the only time they can make a change. But with the 5-star rated plans, Medicare does allow them to have one other election between the end of the annual election period in December and November 30th. So in other words, right now, they can make a selection in any one of those plans if they felt like a different plan would benefit them more.
So if they can make these selections, why should people call you for those decisions?
Well, we've been working with Medicare since 1990.
Wow.
And I have actually an agent that works with me that's been doing it even longer than that. But we have a lot of experience in the Medicare market and with Medicare Advantage plans since they started, really. And so we're quite familiar with the plans here locally, as opposed to somebody that you call on an 800 number. And so we are able to work with people and let them know, what plans work well with their providers. And we're more than happy to come work with people face to face, or we can have the ability to do it remotely. But most people like to be able to sit down with somebody and look at, what's going to work best for their doctors, their dentists, their prescriptions, and their budget.
Now, my parents are in the process of all of this being, senior citizens. Could you talk to me about what is Medicare? Is it a supplement or what is Medicare insurance?
So Medicare itself is a government program, of course. So you have Part A and B that cover hospital and doctor, but with that, people need to either have a Medicare supplement, which we also do, and then they need a drug plan, or they can go to a Medicare Advantage plan, which combines those benefits and then includes things like dental, vision, hearing. So there's other benefits that are included. And so basically they're looking at a choice of paying a premium for a Medicare supplement and a Part D plan, or going to a plan that doesn't have a premium. They just have a copay when they use services.
Now, how does the process work to meet with you? Do you do a consultation and then determine what their best fit is? Could you talk to me about that? Yeah,
that's actually part of it. We go through how these plans work with Medicare, and then we look at who are your doctors, what prescriptions do you take, what dentist do you want to use, and then we try to make sure that it's a plan that will work with those. It's unusual that we would say, hey, maybe a different doctor would work. That's not really part of the plan. We want to make sure that it works with what you already have.
That makes sense. So if they already have a primary care physician they love, you would figure out if Medicare would work with that. Is that how it works?
Or the Medicare plan that they choose.
Medicare plan that they
yes.
choose?
Yes, ma'am.
Do pre-existing conditions impact this, or maybe most people at that age are working through things? How does that look?
So if they're doing a Medicare supplement, if they're past the initial enrollment period, then yes, there are health questions they have to answer, so pre-existing could impact that. That's one of the things with Medicare Advantage, is that because it's a contract with Medicare, there are no pre-existing condition exclusions. Everything's covered right away because it's a contract with Medicare. They're required to cover, just like Medicare would, anything that they have.
And if someone calls a concern about the status of Medicare, what would you say to them?
The status of Medicare?
Well, I'm sure the risk of any changes taking place because of the government or pulling back with that option. Are you hearing anything about that?
Sometimes people are concerned, but Medicare's not going anywhere, I don't believe. So,
that is good to hear. Yeah. Well, thank you for coming in today. How can people get a hold of you and find you?
So our website is mymedicarehelpers.com, and we'd invite people to go there. You'll see our phone numbers, see pictures of some of our agents, but also our local phone number, 423-509-8913. Please give us a call.
I love that. Thank you for coming in today, Mr. Edwards, and best of luck with your business.
Thank you.
Great. Check them out. Senior Benefit Solutions Incorporated, mymedicarehelpers.com?
Yes.
Perfect. Thanks for coming in.
Thank you.